हेलो फ्रेंड्स, वेलकम टू माय चैनल एएमएस एजुकेशन। आज हम देखेंगे टॉपिक ग्रीफ। तो व्हाट इज ग्रीफ? ग्रीफ इन्वॉल्व्स कोपिंग विथ लॉस, death, divorce, and the loss of a home are all major events that people grieve. While everyone's experience of grief is different, there are common responses that can be useful to recognize if you are facing a loss. And what is grief? It is an experience of coping with loss. So हमने पहले भी देख लिया कि ग्रीफ क्या होता है। एक्सपीरियंस ऑफ कोपिंग विद द लॉस। आपने कुछ खोया है, लाइफ में बहुत बड़ा ऐसा इवेंट हुआ है, हम ग्रीफ करते हैं। So most of us think of grief as happening in the painful period following the death of a loved, but grief can accompany any event that disrupts or challenges sense of normalcy or urgency. So बहुत सारे लोगों को लगता है कि किसी की डेथ, हमारे लव्ड वन की डेथ के बाद ही ग्रीफ आता है, लेकिन एक्चुअली कुछ बड़ा इवेंट जो पेनफुल है उसके बाद हमको बहुत मुश्किल होता है नॉर्मल बिहेव करने के लिए, नॉर्मल फील करने के लिए, तो उसको हम बोलते हैं ग्रीफ पे। जैसे कि डेथ, डाइवोर्स, लॉस ऑफ होम, ऐसे बहुत सारे बड़े चैलेंजेस होते हैं, प्रॉब्लम्स होते हैं, जिसके बाद हम ग्रीफ एक्सपीरियंस करते हैं। सो दिस वाज ग्रीफ। सो यू मे ग्रीव द लॉस ऑफ फ्रेंड, फैमिली मेंबर, पार्टनर और पेट, इनका लॉस हुआ है। मैरिज, फ्रेंडशिप और अनदर फॉर्म ऑफ किनशिप, योर होम, नेबरहुड और कम्युनिटी, your job or career loss, financial stability is lost, a dream is lost, goal is lost or disrupted, good health is no more, your youth or fertility is not working. So these are the loss of friend, family member, partner, marriage, friendship, home, neighborhood, community, job, career loss, financial stability, dream or goal, good health, your youth, fertility. Stages क्या है ग्रीफ के, इंपॉर्टेंट है। What are the stages of grief? First is denial, anger, bargaining, depression, acceptance. Denial. You may have difficulty accept that loss is real. हम accept नहीं कर पाते, मान नहीं पाते कि जो loss हुआ है वो सही में खोया है हमने। Anger, गुस्सा आता है। You may direct anger at multiple sources, including people who couldn't save a loved one, God, yourself, and even no one in particular. सब पे गुस्सा आता है। Bargaining. You may imagine reaching on an agreement so you don't have to deal with the loss. You may also regret past actions that you imagine could have spared you from the loss. Bargain करते हैं. Depression. You may experience the complex emotions associated with depression, including emotional detachment. Acceptance. Eventually, most of people embrace the reality of loss, even if the pain is still there. तो lastly हम accept कर लेते हैं कि हमारे साथ जो हुआ है हम उसको मान लेते हैं। हालांकि दर्द तभी भी रहता है, लेकिन हम उस चीज को एक्सेप्ट करते हैं। तो सबसे पहले जो स्टेज रहता है वो डिनायल है। हम चीज को नहीं मानते कि ये चीज हो गया, वो चीज खो गया है। उसके बाद हमको गुस्सा होता है कि मेरे साथ ही क्यों, मेरे साथ भगवान ने ऐसा क्यों किया। देन बार्गेनिंग। फिर हम कोशिश करते हैं कि मैं ये बात सुन लूंगी, मैं ये अपने आप को सुधार लूंगी, इम्प्रूव कर लूंगी, लेकिन वो जो लॉस है उसको आप रिवर्स कर दीजिए, वापस ला दीजिए। डिप्रेशन। उसके बाद हम इमोशनली बहुत ही ज्यादा लो फील करते हैं और लास्टली हम एक्सेप्ट कर ले कि ये हमने खो दिया है। तो दीज आर द स्टेजेस ऑफ ग्रीफ। देन व्हाट आर द टाइप्स ऑफ ग्रीफ? So first is anticipatory grief, abbreviated grief. Anticipatory grief, it involves grieving before the actual loss. For example, you may begin grieving when you learn that your loved one has a terminal illness. Processing grief beforehand can prepare you to face a loss when the time comes. Still, it's important not to allow grieving to distract you from enjoying the precious time that you have. So, anticipatory मतलब कुछ होने से पहले ही हम grief करते हैं। जैसे कि हमको पता चल गया कि हमारे कोई अपने को टर्मिनल इलनेस हो गया, तो हम पहले से दुखी होना चालू कर देते कि शायद वो सामने वाले को हम खोने जा रहे हैं, जीवन में कुछ ही समय बचे और अब उसको खो देंगे। तो दैट इज एंटिसिपेटरी ग्रीफ। दूसरा है abbreviated grief. Sometimes you are able to move through the grieving process quickly. This is the case with abbreviated grief. Abbreviated grief may follow anticipatory grief. You can grieve a loss quickly because you have already done a lot of emotional labor while anticipating that loss. Grieving for a short time does not mean you never truly cared about what you lost. When it comes to grief, we are all on different timelines. So abbreviated grief, ग्रीविंग प्रोसेस को हम क्विकली करते हैं, उसको बोलते हैं हम लोग एब्रीविएटेड ग्रीफ, क्योंकि हमको पता था पहले से कि वो चीज होने वाला है, वो चीज जाने वाला है। उसको पेन को हमने शुरू से ही एक्सपीरियंस करना चालू कर दिया था। तो जब एक्चुअल में वो चीज होता है, पेनफुल मोमेंट आता है, तो हम ग्रीविंग प्रोसेस को क्विकली कंप्लीट कर लेते हैं, तो उसको हम बोलते हैं एब्रीविएटेड ग्रीफ. Delayed grief. Instead of experiencing emotions that accompany grief immediately after loss, you feel them days, weeks, or even months later. In some instances, the shock of loss pauses your body's ability to work through these emotions, or you may be so busy handling the practical matters that accompany loss, like funerals and wills, that your body can't grieve until you have handled these responsibilities. So delayed grief जिसमें हमें grief का जो emotions है वो थोड़ा बाद में आता है, धीरे से आता है. कारण कुछ भी हो सकता है, या तो आप शॉक में हो या फिर कुछ प्रैक्टिकल रिस्पॉन्सिबिलिटीज को निभाने में इतने मगन हो गए हो कि आप ग्रीफ करने में डिले कर देते हैं. दैट इज डिलेड ग्रीफ. Inhibited grief. It involves repressing emotions. Most of us haven't been taught how to process or even how to recognize the confusing emotions can arise when we are grieving. As a result, many people who repress their emotions don't realize they are doing so. Unfortunately, when you do not allow emotions yourself to pause and feel this emotion, grief often shows up as physical symptoms like upset stomach, insomnia, anxiety, or even panic. So this is inhibited, जिसमें हम emotions को repress कर देते हैं. हमको पता नहीं कि हमको कैसे एक्सप्रेस करना है, दबा देते हैं. तो इस तरह से हमको नहीं पता, ये कुछ चीजें होती है जो सिखाया नहीं जाता, ये नेचुरली आता है. सो इसकी वजह से फिजिकल सिम्टम्स दिखते हैं, जैसे कि स्टमक अपसेट हो रहा है, इंसोमिया है, एंजाइटी और इवन पैनिक अटैक. सो दिस इज इनहिबिटेड grief. Cumulative grief. With a cumulative grief, you are working through multiple losses at once. For example, you are not only grieving the loss of a child, you are grieving the ending of a marriage that followed that loss. Grieving multiple losses simultaneously make the process difficult and complex in unexpected ways. So, multiple losses की वजह से cumulative grief, एक के बाद एक grief चलता रहता है. That is cumulative grief. Collective grief. Most of us think of grief as personal, but collective grief too. Major events like war, natural disaster, school shootings, pandemics create far-reaching losses. They change what counts as normal life. As a group, we grieve the shared experience we have lost as we struggle to imagine a changed future. So collectively, like war, natural disasters, जो बड़े ग्रुप में एक साथ हुआ है, पैंडेमिक हुआ है, तो बहुत सारे लोग मिलके कॉमनली जो बनाते हैं, एक्सपीरियंस करते हैं, उसको बोलते हैं हम लोग कलेक्टिव ग्रीफ. Now, what are the symptoms? Symptoms of grief. Emotional symptoms like people who grieve often describe emotions as coming in waves. It may feel as if emotion wash over you without warning. 1 minute life may feel as they're back to normal, and the next you may find yourself in tears. So ये इमोशनल सिम्टम्स लोग एक्सपीरियंस करते हैं द ग्रीफ. कभी उनको अच्छा लगता है, कभी रोने लग जाते हैं, फिर उन लोगों को लगता है नॉर्मल हो गया. बट ये जो टाइम पीरियड होता है, ये वेव्स की तरह ऊपर नीचे चलता ही रहता है, फ्रॉम सैडनेस टू एंगर टू जॉय. You may sometimes feel detached from your emotion and operate as if you were autopilot. You may experience confusing and conflicting emotions too. Sadness that a loved one's gone, but relief that they are at peace. Yearning for a spouse after a divorce, but also excitement that you get another shot at love. Guilt for feeling grateful that you no longer have to provide exhausting around the clock care for a dying relative. Competing feelings of apathy, anger, sadness, and regret as you grieve the loss of a friend or family member with whom you had a strained or hostile relationship. This is emotional symptoms. Physical loss is an extreme stressor that can make major physical toll on your body. Grief can overwork your nervous system. It can cause weakened immune system. और सिम्टम्स क्या हो सकता है, इम्यून सिस्टम को वीक कर सकता है, फैटिग, हेडेक्स, नॉशिया, रेस्टलेसनेस, अपसेट स्टमक, हार्ट पल्पिटेशन, weak muscles or joint pain, tightness in your chest or throat, having reduced or increased appetite, trouble sleeping, insomnia, or sleeping too much. Behavioral changes. So grief can make it hard to concentrate. आप concentrate नहीं कर पा रहे हो, distracted रह रहे हो, complete task को complete नहीं कर पा रहे हो, confusion रहेगा, trouble thinking या decision making नहीं रहेगा, feeling as if you have lost a sense of hope or direction, difficulty focus on anything other than your loss, difficulty remembering or keeping track of your responsibilities. Complications क्या रहेगा grief के? Absent grief, ambiguous loss, diffranchised grief, traumatic grief. Absent, when you don't show any outward signs of grief. Sometimes you may exhibit signs of grief because you are frozen in denial. Other times, a person who may not appear to be grieving is privately working through complex emotions others can't see. So this is absent, जो दूसरे को नहीं दिख रहा है. Ambiguous love, when there is lack of closure around a love. For example, it may be especially difficult to move through grief when a loved one is presumed death, but their body is not fine. डेथ की खबर आ गई लेकिन बॉडी नहीं मिल रहा है, कहीं खो गया था. Ambiguous loss also include grieving a loved one who is still alive but feels out of reach, as with someone incarnated or deported. You may grieve changes that create psychological distance from a loved one, as with dementia or Alzheimer's. Disfranchised grief, when society doesn't consider a loss worthy of grief, grieving can feel especially isolating when others signal that your grief is not valid. Example includes the death of a pet or loss of same-sex partner. It involves death that society considers taboo, like death from suicide or drug overdose. Traumatic grief, when you are processing a loss and trauma at the same time. Traumatic grief involves losses that happen under horrific, unpredictable circumstances. Natural disasters, accidents, violent deaths can all lead to trauma or even PTSD that you will need to process and seek treatment for alongside grief. So this is traumatic grief. Grief can be considered complicated or prolonged when even a year after the loss you feel as if a part of yourself is lost or died. Don't believe the death or loss of academics. ग्रीफ को हम कॉम्प्लिकेट कब बोलेंगे? अगर ये बहुत लंबा जा रहा है, 1 साल होने के बाद भी अगर आप खुद को खोए महसूस कर रहे हो या खुद को मरा हुआ महसूस कर रहे हो और अभी भी बिलीव नहीं कर पा रहे हो कि सामने वाले को आप खो चुके हो, ये सामने वाले का डेथ हो चुका है. Avoid reminders of death or loss. Experience the intense emotional pain relating to the loss that interfere with daily living. आपका daily living areal जो है वो affect हो रहा है. Feel emotionally numb, lonely, or as if your life doesn't have meaning or purpose. Find it difficult to live with, make plans with friends, participate in activities you enjoy, or make decisions for the future. Then grief will be considered complicated. How to cope? How can you cope with grief? Taking care for yourself. So you need to take care of yourself. That is most important. Practice self-care. Taking care of your mind and body is essential when you are grieving. Prioritize getting 7 to 8 hours of sleep. Take a nap if you need to recharge. Exercise. Eat regular nutritious meal. Meditate or practice yoga. Take bubble baths. Make caring for yourself a priority as you grieve and don't feel guilty about it. Stick to a routine. Grief interrupts your sense of normalcy, disrupting your emotions in the process. Stick to a routine. It's a good way to regain a sense of control and regulate your emotion. Go to bed and wake up at consistent times. Eat meals at the same time each day. Shower, tally each task you complete as a win. Attend your emotion. Resist the urge to distract yourself from difficult emotion by getting lost in work or hobbies. Reach out to others. One of the best ways to deal with loss is to remind yourself of the connection you still have. It's okay to need alone time when you're grieving, but don't isolate yourself. Speak to a therapist or grief counselor. Sometimes working through grief requires professional help. If grief is interfering with your ability to live your life, or if your symptoms haven't improved after 6 months, it may be time to reach out to a professional. So this was about the topic grief. I hope you like the topic. Then please like, share and subscribe and give your feedback in comment section. Thank you.